Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
This is Phil Ferris, and welcome to our show. Never Too Late for Fitness Radio provides answers and straight talk about fitness, nutrition, and healthy lifestyles for people over 50. Our goal is to educate and advocate health and fitness strategies that help you live a longer, healthier, and happier life. On some shows, we feature everyday people like you and me who have acted and reclaimed their health and fitness. We all love a success story, especially if the person is facing the same challenges we face. Hearing real success stories helps inform, motivate, and inspire us to live a healthier life. On other shows like today's, we focus on companies or health and fitness industry professionals who share how they help their clients over 50 achieve their goals. If you suffer from back and neck pain, this show is for you. If arthritis pain in your knees and your hips or joints is getting the best of you, this show is for you. If you're looking for a natural remedy for the pains that are slowing down your life, this show is for you. My guest today is Dr. Robert Hedaya, MD. He is a clinical professor at Georgetown University Hospital, on the faculty at the Institute for Functional Medicine, is the author of 3 books on the biological aspects of psychiatry, and is working on a 4th one. He has authored various peer-reviewed journal articles and has been a national speaker for traditional and functional medicine and lay audiences around the country. He is the creator of an extremely popular and unique herbal preparation called Dr. H Rejoint, which he actually developed for himself after a biking accident. Dr. Hedaya is really a unique medical type, as he has one foot in the traditional medical world at Georgetown, but at the same time, he is a pioneer in the use of functional medicine. As if that weren't enough, Dr. Hedaya has almost 40 years of clinical experience to boot. So Dr. Hedaya, thank you so much for being on the show today. What I'd like to do is I'd like to begin by learning more about your background and the events that led up to you developing Dr. H Rejoint. Can you describe the journey that you went on to develop this amazing product?
Hi, Phil. Thank you for having me on the show. First of all, I'm trained originally at Georgetown University as a psychiatrist, and eventually, over time, recognized that a lot of the problems my patients were having were actually stemming from medical problems, not psychological problems. So, for example, B12 deficiency causing panic attacks, etc. So my mindset was always expanding out of the normal bounds of psychiatry. I myself had some chronic fatigue after my first book in '96. And so I kind of, at that point, got into functional medicine very heavily. Functional medicine is kind of a systems biology where you look at nutrition and hormones and the immune system and inflammation and genetics, etc. So anyway, I cured myself with the functional medicine approach and started to use it on my patients, and was very involved with that, and really put my psychopharmacology training aside because I found I didn't really need it too much. And part of my own self-cure from my chronic fatigue was biking. So I actually began biking probably 30, 40 miles a week, maybe more than that really. And then in about 2010, around Thanksgiving, I was biking in Washington, D.C., and I fell and had an accident and really injured my back. The pain was quite intense. And then I was kind of going through the routine medical process that everybody goes through. I was really just a patient. And I went through about 9 months or so of trying various treatments. Nothing worked, side effects of medications, etc. And it was quite a struggle for me, just functioning, driving, sitting in the chair at work. Every day was a struggle. And then I realized, I was talking with my sister actually, and realized in the process of talking with her that my problem wasn't really so much pain. Obviously, that was the symptom, but the problem was really inflammation. And I thought, I'm a functional medicine doc. I could figure out how to solve my inflammatory problems. So basically started looking at different formulations that worked for inflammation, and doing research on herbs that helped inflammation, and started formulating my own things when the glucosamine, chondroitin, curcumin, turmeric, all of those things, they just didn't work for me. And so I started researching different herbs and trying different formulations. I work with compounding pharmacies. And so I came up with a formula that seemed to work pretty good. And then I started to try different sources, because where an herb is grown and the conditions under which it's grown actually affect the composition of the herb, which makes sense. We know that to be true with wine, for example. Where the wine is grown affects the flavor of the wine, etc. So eventually I came up with what I thought were the best ingredients and the formula. And it was really striking for me, because when I used this, the next day my pain was gone. And I thought, gee, this is just a fluke. This is just an accident. So I stopped the formula, and my pain came back. And I restarted. I did on, off a few times. And then I was convinced that my formula was working. And then I thought, okay, there must be some kind of drug in this, because this is just too effective. So I sent the formula to a lab to get it tested for various medications that might be pain relievers. Came up perfectly clean. And then I was, wow, this is really something. So then I started to use it with my patients, and my patients would come in and ask for, some of it for their friend or their relative, etc. And basically that's how it developed. And from there, it just basically has grown on its own.
That's a fascinating story. Now, tell me a little, I want to drill down a little bit about the area of inflammation. Why did you focus on the inflammation? Because our body needs inflammation in order to heal. So maybe you can help us understand that inflammatory process and how your product addresses it.
Okay, so we need inflammation to heal. You get a cut, you have an injury, you need an inflammatory process. What we don't really need is inflammation that becomes chronic, that goes on and on and on and on. I always say to my patients, look, if you don't get hit by a truck, you're going to die as a result of inflammation, because almost all the chronic illnesses that we suffer from, whether it's heart disease or diabetes or asthma or Alzheimer's disease or depression, list goes on and on, even cancer. These are diseases of inflammation. And so what I realized is that my pain signal that I was getting was not because I had some damage somewhere that needed to be healed, a particular nerve that was damaged, but that I really had an inflammatory process going on throughout my body, and that it was just showing up in the place that was most vulnerable, which happened to be my back because of my injury. And so that's how it works. That's if you're having pain, chronic pain. I don't mean acute pain. If you're having chronic pain, it generally means that you have an inflammatory process in your system, in your body, that is showing up in the places where you have been previously injured or are vulnerable.
Okay. And I had a meniscus tear in my knee. And what was explained to me was that it's not going to heal. So if I irritate it, it's going to stay inflamed.
Mm-hmm.
And so it's the body trying to heal because there's a slight tear, but it's not going to, because you're not going to grow new cartilage unless you do stem cell or something like that. And so, that's a thing they said, oh, you just got to live with it, which is not something most people like to hear. Now, what are the most, when it comes to inflammation, what are some of the most common, I guess, misconceptions people have about inflammation, and how do you help them overcome those misunderstandings and misconceptions?
Yeah, so I think I don't know if people really understand what inflammation means, but it's basically means swelling, increased blood flow to the tissues. Pain is a part of that, it's there are so many. The inflammatory pathways are complex. In other words, the molecules and metabolic pathways that are involved are very complex. And the way we help people with H Rejoint, Dr. H Rejoint, with this product, this formula, and this was really, I think, my main insight, was that most pain medicines or supplements work on one or two pain pathways. So if you take ibuprofen, or, for example, it might be, it's a COX inhibitor. It works on one pathway. I thought, you know what? When I'm formulating this product for myself, I'm going to look for a combination of herbs that cover as many pain inflammation pathways as possible. So instead of attacking one target or two targets, we actually we target 9 pathways, including what I think of as the grand central station of pain, which is an inflammation, which is TNF alpha and NF kappa B, which is really the core, because when you have inflammation, almost everything goes through the TNF alpha receptor, which then communicates that signal to the nuclear factor kappa B. And then from there's a whole stream of literally hundreds of genes that become activated or deactivated to create the inflammatory cascade. Our herbs, the combination of 5 herbs in our product, targets a total of 9 different aspects of the pain pathway. Among those are the grand central station of pain that I talk about.
Okay. So another, I know one of the misconceptions that I run into with both the clients I work with and listeners is the one is just to resign. Just the other day, a client came into the club and said, I said, how you doing today? And he said, well, I'm kind of moving kind of slow. He said, but that just goes with the territory when you get to be my age. And there's just like the acceptance that I'm going to have to live with pain.
Mm-hmm.
And that's not necessarily the case. And then the other is, well, I'll live with it because I don't want to get hooked on drugs. So those are two things I've heard very commonly, that I have to live with it. So I have my quality of life goes down, and my option is to take a pain drug that can be addictive. And
well, let me comment on that. Those are two things. Look, pain is something many people struggle with. The key here is actually, as you say, you may not have to live with pain, and I would say, you've taken this supplement. I think you've found, you can talk about your experience, but you have to reduce the inflammation, and you want to reduce the inflammation through your diet. So basically, you want to reduce the intake of inflammatory foods, and these can be, people can do a search on the internet, look for a low inflammation diet. You basically want to eat foods that are kind of whole foods, meaning they're not processed. So you actually have to cut out a lot of the stuff we love, like breads and cakes and juices and candies and muffins and bagels, and you want to eat fish. Which is very healthy. Small fish in particular, like herring, mackerel, sardines, or better fish. Large fish like swordfish are not good. But or take a fish oil capsule. But fish is very healthy. You want to try to avoid things called nightshades, which are like eggplant and tomatoes, potatoes. They can, for some people, be inflammatory. Some people have to avoid foods that contain oxalates, which can cause pain. And some people, so I would say the best thing to do is maybe start, if you have pain, start with a elimination diet. Again, you could just Google elimination diet. Do that for 2 weeks. So you want to reduce the source of inflammation. It could be food. You may need also to activate the muscles around your knee, for example. If you strengthen your knee, you clean up your diet, and you take the Dr. H Rejoint, the chances are actually very good your knee pain will actually be reduced, could be 90%, So it's really a multimodal approach that people should take. The DRH Rejoint is actually remarkable because I've had people with severe conditions like rheumatoid arthritis, for example, who've been able to reduce their medications gradually over time, because in fact these herbs work at some of the pathways that the heavy-duty medications work at, except these medicines are better. These herbs are better than the medicines because they are what we call adaptogens, meaning if the setting on your TNF-alpha and NF-kappa B should be, say, at 50% in a healthy person, the medicines that people are taking, the biologicals, actually turn it down below 50% and actually may turn off the activity of TNF-alpha and NF-kappa B. And that's why these people who take these medicines can get a lot of infections and colds and immune problems. Well, the herbs that nature provides don't do that. They are adaptogens. So if your TNF-alpha is overactive, it brings it to 50%. If it's underactive, it brings it up to 50%. Actually brings your set point to the proper place. So there's actually an advantage to the herbs that nature provides that medications can't match.
Okay. And you mentioned that my experience, it's limited to the fact that after one day, the inflammation in my finger on my right hand is reduced probably 95% in just one day, and the same thing with my knees. And that's something that, because I play tennis, the reverberation when I hit the tennis ball on the hand, because it's on my right hand, tends to agitate the inflammation, so it will be worse a couple days after. And then it's usually some rest, and I keep moving it, and there's other things I can do. Same thing with the knees. I'm constantly doing weight training and flexibility training so that minimizes it minimizes the source of the inflammation as much as possible. But knowing that there is relief from that, pain a couple days after tennis is very reassuring. But again, there's a reason for the inflammation, and your product helps deal with the pain aspects of it. But there's also some lifestyle choices that people need to make if they really want to make sure that the inflammation goes away. Mm-hmm. Now, the ingredients in your product are not unique. I mean, anybody with a can Google them. Yet the results they produce are. So, can you explain why your proprietary blend is so effective with five commonly available products?
Well, so yeah, I think it's unique for two reasons. One is where we source it and how we extract it. And the second reason is that the combination, I carefully chose these because I was actually basing my choice of herbs on the inflammatory pathways. So I said, well, I want to reduce activity of MMP9 and MMP13, which cause tissue destruction. I want to reduce activity at the HLE, the human leukocyte esterase pathway. I want to reduce the bone cells that break down bone. I want to reduce the cytokines, interleukin-1 beta, et cetera, et cetera. So the reason it's so effective is the herbs are of the highest quality, and the extraction process is of the highest quality. So we get a lot of potency. And then also that it's not some willy-nilly kind of thing. We targeted the specific pathways. And the other thing I'll say is that they're highly absorbable. Now, if you take turmeric or curcumin, actually the studies show in animals that you don't affect the cytokines, which are part of the inflammatory pathways, for 21 days. So you take curcumin, it's a very slow process. Now, curcumin is good very quickly for the gut, inflammation in the gut. It can be very quick. But the manufacturers know that absorbing curcumin is quite difficult. And they've been working on this for at least a decade. So in the animal studies, they actually inject it into the abdomen, and then they say, oh, look, it reduces inflammation. But we're obviously not injecting curcumin. So that's another factor. My formula has herbs that are readily absorbable. That's why you responded to it within a day, because it was absorbed and it did its job. Whereas curcumin, which gets a lot of press and has great activity in labs, but it's the absorption is highly is erratic or difficult. Let's say it's difficult.
That's why I know I've talked to people that they get results, but the dosage amount they have to take is huge. So right. It's not just how much you take, it's how much is assimilated into the body. Yeah. I want to kind of drill down into a little point about why it's important to have quality of the product, and what happens if you don't have consistent high quality in the ingredients.
Well, it's where there are two issues. One is, how safe is the product? Are there heavy metals? Are there toxins? Is there E. coli? Is there lead? Is there fungal, bacteria, in the product? So we get every batch is thoroughly tested by a third-party laboratory, and then it's really it's, I think, the soil and the sun and the amount of rain that create a plant that is generating the constituents, and there are really hundreds of constituents to each of these herbs, that you get a really full complement of the chemicals, the molecules that are anti-inflammatory. So that's the key. I have actually, in the process of developing it, tried the same exact formula from different sources. And this source was far and away superior. So that's why I feel it's really the soil and the sun and the amount of rain, et cetera.
I have to concur, because I know that a lot of people say, "Oh, I can get that same product, whatever that product is, at a big box store, and it's the same thing, only it's cheaper."
Right.
And the question is, do you know where the ingredients came from? Do you know if they're safe? Well, no, but it's cheaper. And I always caution people, just be careful what you put in there, and you make sure that it is quality ingredients. And then,
that, Phil, this it's when I manufactured it initially, after everyone's asking for it, et cetera, the price is high. It's not an inexpensive supplement, but I really had no choice but to do that, because the cost of the raw materials were just so high. I mean, the cost of our raw materials are 4 times higher than I can cut the cost dramatically just by switching to other sources. But I can't, because what's the point of putting out a product that's really not going to work well? Never was, and am not particularly interested in being in the supplement business. I just kind of got into it because I, had this accident and found something that worked for me and for other people. And so I just felt compelled to share it. This is not a high profit product. We barely do any advertising because we don't have the money to advertise, but we're helping a lot of people. And so that's the main reason we do this.
Well, let's talk about the people that you help. For people out there, what are some of the specific issues that may come up that would be a good candidate to take the product?
Well, the simple answer is, in a way, anything that has a itis, So really, because itis means inflammation. So I've had people respond with prostatitis. We don't advertise it for that, but people respond with prostatitis, chronic prostatitis. I've had people with, of course, arthritis, even rheumatoid arthritis. I've had people respond. Actually, my partner takes it for his sinusitis, which is, again, inflammation. He swears it works for his sinusitis. And then people take it for tendinitis, So, you can have pain, you can have pain in your neck. It's really so broad that I think there's, if you have pain and inflammation, but I've had people take it for, this is pretty amazing, for acne, right?
Okay.
Again, I'm not advertising it for that purpose, but I've had patients with drug-induced acne where it has reduced their acne by 50%. So acne is an inflammatory condition. So we're just saying, hey, this is good for joint and muscle pain wherever it is, but really it's got a broader application.
Okay, but Johnny, if someone has a stiff back, neck, sore knees, especially when they get up in the morning, and that kind of discomfort that kind of comes and goes, is a pretty good indication that there is a solution, and that it's not just a matter of living with it. So that would be those would be the kinds of things that that you'd look for. That this could be the weekend athlete, and it could just be the person that says, "Hey, my arthritis is acting up today," or for people like the guys I play tennis with that talk about my elbow and my knee and my back, and they want to keep playing. How do I do that? And to get that relief so that they have the mobility and they don't have the inflammation.
I have a friend of mine who she was having trouble walking because of tendinitis in her foot. Even gout or bursitis or people who have bunions, for example, can get benefit from it. So this friend actually had tendinitis in her foot, and so I gave her a sample of it, and she contacted me from New York. She says, "I walked 3 miles." I'm so happy. She takes it every 2 weeks. So that means that her system is so sensitive that she just gets a correction of the molecular pathways with just a couple of capsules, and that seems to normalize things for her for a couple of weeks, and then she'll take it again. Other people take 2 twice a day. Myself, I've been taking it since 2010 or so. I take 2 capsules twice a day. But everyone's different. But it's for many people, it's very helpful. I've had people actually cancel their hip or knee surgery because they got so much relief from it.
Wow.
It's remarkable. So, that's a great thing, because there's actually now data that 23% of people who undergo hip or knee replacement surgery, and it's related really to the general anesthesia, 23% of them end up having cognitive decline.
Okay.
So that's good to avoid those if you can.
Yeah. So let's talk a little bit about the doses, how you use it. So what is the recommended dosage for people to use this? And you started talking about some people use it a couple times a week, and some people every day. Yeah. So
so I would say,
what to expect.
Yeah, I would say that everyone's different, but some people have a response like you within a day, like me within a day, and some people with more, say, people with rheumatoid arthritis. I've had people with rheumatoid arthritis. Some people take 3-4 weeks to feel that there's a benefit. Some people take 10 weeks to see if there's a benefit. Most people, however, will notice a benefit within a few days to a couple of weeks. So I would say you start out taking 2 capsules twice a day in the middle of your meals. This is not to be used if you have ulcers, or if you have a history of ulcers, or you have kidney disease, or if you're on warfarin or Coumadin. You are not to use this. Of course, if you're pregnant or you're lactating, you do not use this. This is not approved for use in minors. So there are, certain people who shouldn't be using it. If you're one of those, don't do that. But otherwise, you start with 2 capsules in the middle of breakfast, 2 capsules in the middle of dinner, and just do that. Go through a bottle and see how you do. If you have one of these more serious inflammatory conditions, then I would say, give it a longer period of time. But for the vast majority of people, you're going to notice a significant improvement with the first bottle, usually within a few days to certainly within a couple of weeks.
When it comes to anything new or any supplement, people have concerns or fears about supplements in general. So what are some of the fears people may have about Rejoint, and how do you answer those so that they don't have those concerns?
We haven't really had people expressing concerns. I think that actually yesterday was something in the Wall Street Journal about supplements and ingredients that shouldn't be in there. The ingredients are often in weight loss products or testosterone products, things like that. We test our materials in a third-party facility, and so we know that they're pure. We know that they're clear. Actually, some of them are organic, but we don't put that on the bottle because they're not all organic, but they are all tested for heavy metals and fungi and E. coli, etc. So I think it is quite safe. I use it myself. My family uses it. My daughter uses it for her dog. So actually, so it's quite safe. I think that's the first thing. The second thing is, will it interact with any of my medications? The only medication interaction that we have any concern for is people who are taking Coumadin or warfarin, because there is an interaction, and that's something that can make the Coumadin or warfarin less effective, so that you want to stay away from it. If you have kidney disease, you don't want to take it, and certainly if you've had ulcers, you don't want to use the product. Other than that, it's safe, and we have really had very, very, very few problems with it.
Okay, so now, Dr. Hedaya, we've covered a lot of ground today. What's one thing we may not have covered that you'd like to share with people listening to help them live a healthier, pain-free life?
Boy, that's a good question. So I think the most important thing is to know that there are ways of treating your pain, but they usually have to have a multimodal approach. So changing your diet, taking a supplement, exercising the muscles. These are the approaches. It's kind of a more broad base. One of the things we didn't talk about is the adrenal glands. The adrenal glands help you deal with stress and control inflammation, and then sleep is obviously very important. So when you're thinking about your pain, try to think in a kind of well-rounded way, and don't just look for, let me take ibuprofen. Ibuprofen is so bad. Ibuprofen, for example, if you take ibuprofen or these non-steroidal anti-inflammatories, they actually block your ability to use testosterone. Testosterone is something both men and women need, and obviously the older we get, the less we have. But even in someone who's a younger person who's popping ibuprofen, it can cause damage to the intestinal tract. It can cause you to develop microscopic holes in your intestinal tract. It actually stops the inflammation, And then actually you'll have a rebound and increase in inflammation because you'll have leaky gut and you have lots of other things going on. So it's actually damaging you in the long run. So when you're approaching your pain, really, try to approach it in a healthful way and don't say, well, let me just find one pill, and pop the ibuprofen, or even Tylenol, by the way, is harmful for the liver. Certainly shouldn't be mixed with alcohol. So you really need to take pain as a signal, not only for some injury in the particular tissue where you're having your pain, but as a signal that, hey, maybe I need to reduce the inflammation, because if you reduce the inflammation, not only will you have less pain or your pain will go away, but your overall health will improve. You will have reduced risk for dementia, reduced risk for heart disease, for other cardiovascular diseases, et cetera, et cetera.
Well, thank you. So if people want to contact you or learn more about Rejoint, where should they go?
So a few things that I should say, that when people order the product, they can either go to drhrejoint.com. If they want to speak to somebody, they can contact Jill at 201-875-8055 and press 0 for the operator. That's 201-875-8055. Or they can email drhrejoint, REJOINT, at gmail.com. Now, they should know that if they put in a discount code when they order, the discount code is Phil. That's your name, Phil. Yep. They'll get a $10 discount on the product. And also, for everyone who uses that code, 20% of the cost of the product is going to go to the charity for Hurricane Michael. So that's $15 per bottle that's ordered is going to Hurricane Michael. Usually we send $15 to Make-A-Wish Foundation, but we are switching that to go to Hurricane Michael, victims of Hurricane Michael. So again, it's Phil is the discount code. And the phone number is 201-875-8055. Press 0 for the operator. And if you want to email, it's dr, like Dr. H, rejoint, REJOINT, at gmail.com.
Well, thank you. And again, thank you for the product. When we first met, I said thank you because the relief was so quick and immediate. Then I was surprised because I was expecting maybe 3-4 days before I saw the benefits. So it's a product that works. It has a lot of potential. So I encourage people to do that. And not only will you help your own health, you will help people that are suffering from the carnage from Hurricane Michael. And again, Dr. Hedaya, thank you so much for sharing your information and for providing such a wonderful product.
Thanks for the opportunity, Phil. I really appreciate it.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.